So with that, we move ahead to Dr. Neelam Verma. Dr. Neelam.
Yeah, good
And I would
afternoon.
request the second speaker to be ready since Dr. Bhalla is coming late. So after this, Dr. Vinita would be there.
Yeah, good afternoon, everyone. Thanks, AIOS and Dr. Shweta Tripathi for inviting me. So I'll be talking on glaucoma compliances. They are not moving, I think. The slides. Okay, as we all know that glaucoma is a chronic disease and it is mostly asymptomatic in the early stages. So it has a low adherence and a persistence rate, which could lead to its progression. So there are two terms which are related to compliance. One is the adherence and the other is the persistence. So adherence is a measure of degree to which patient will follow the instructions of his or her physician during a defined time period, whereas persistence is measure of time to first discontinuation. So when we talk of day-to-day basis, it is the adherence, and on long-term basis, we say that the patient is persistent. So I'll give you an example. If suppose a patient is prescribed pills twice daily for 30 days, the patient takes only 20 pills, so the adherence is 1/3. And if a patient is prescribed, say, drug X on January 1st, who fills the first 2 months of prescriptions regularly, but miss the one for March, is persistent only for first 2 months. So twice daily pills for 30 days. If patient takes once every alternate day, but continues to refill prescription every month, so the patient is persistent with adherence of only 25%. So there are some common obstacles to adherence in their decreasing frequency, like situational and environmental factors related to their medication regimen, patient related and physician related. So coming to one by one. So for situational and environmental factors, the common factors associated are denial, lack of education on the part of the patient, travel issues, cost of medication, lack of insurance. They might be single or staying alone. So we should be educating our patients more than studies have shown that patients who are educated by providing some written material or through internet or by family or their friends in just addition to their physician were better educated, and we should also be providing specific information about their disease and consequences and importance of follow-up. So related to medication, there could be complex schedules and side effects and tolerability. So one should be asking questions repeatedly to our patient about their drop taking behavior, and we can simplify the regimen to fewer daily doses. There might be difficulty administering patients because these patients, as we all know, are older patients, might be suffering from dementia, other diseases like rheumatoid, Parkinson's. So we can suggest some delivery aids. Forgetfulness, yes, is common. We can discuss strategies so that they remember putting their drops. We can associate with their some daily routine like brushing their teeth, or they can place at their bedside. Or cyclical behavior from white coat syndrome is like when patient becomes compliant just before his or her visit to the physician, maybe 5 to 7 days prior and after visiting. And the doctor's factor, we all know that we run busy clinics, so we should try to improve communication. We should we should not only prescribe medications, but teach how to instill medication, wait between two instillations, and also teach them the role of punctal occlusion and gentle lid closures, and finding adequate glaucoma treatment which fits best into the patient's lifestyle. And we advocate frequent follow-ups and testing if we think that patient is progressing despite compliance. So how do we monitor adherence? So there are some direct methods like observing the patient take the medication, but it is not feasible, and we can measure the concentration of drug or metabolite in blood or urine, but that is costly. And there are some indirect methods which are more commonly used like physician estimated, patient self-reporting, and questionnaires which are simple and more commonly used. Pharmacy refill rates. Then we can check the amount of medication in the bottle at each visit. Electronic medication monitors, clinical response, and patient's maintenance diary are some other indirect methods. So, what are the pearls for increasing the adherence in our patients? So, we can spend some extra 2 minutes with our patients for educating them and communicating them better. Then we should try to improve our skills to best fit the medication in a particular patient and address if there are barriers present. So we should be have become non-judgmental so that patient can tell us about any barriers or inhibitions or factors associated with their non-compliance. Then we should be asking open-ended questions repeatedly and putting emphasis on their disease and how to decrease the progression, how to instill medication. So we should be talking to them at every visit and reinforcing them every visit based on patient's need, social circumstances, knowledge and education level. Tracking patients who fail to follow up, maybe using a telephonic reminders for appointments, is another way by which we can try increasing the adherence of these patients. So the medications only work for patients who take them. Thank you with this.
Thank you, Dr. Neelam. I would request Dr. Vinita ma'am to give some clinical pearls for the same.
Dr. Neelam, nice presentation. The most important factor for glaucoma management and its progression is compliance and persistence, for which we should give a very good chair time. Individually, in my practice, I tell my patients to bring the medicines to me and I check. Most of the time, they might put prostaglandin analogs twice or thrice, so you have to check yourself about the bottles and the drugs which they are using. Secondly, the treatment which you are prescribing to the patient needs to be individualized. You cannot prescribe medicines taking patient into the consideration. So always involve the patient in prescription, then only your glaucoma management will be successful.